Here today at the Arizona Biltmore Hotel, which was built back in 1929. When you look at an aerial view of Phoenix in 1929, there wasn't much here. Now it's a sprawling metropolis. I think it's like the fourth largest city in the country. Back in 1929, the Arizona Biltmore Hotel, when it was done, was called the Jewel of the Desert. Well, in my opinion, I'm just one person, but it is still the Jewel of the Desert. It's undergone multiple renovations, and it has a little bit of a classic contemporary feel to it now. People think that it was actually designed by Frank Lloyd Wright. Well, that's not true. Did he help? Yeah, he did. He was a consultant on the project for 4 months. But the real architect and designer was Albert Chase MacArthur, who was a student of Frank Lloyd Wright. Albert Chase MacArthur and his brother were the actual designers and owners of the Biltmore Hotel during its construction. But they ran out of money. Once they got over the $1 million budget, it actually turned into a $2 million project, which now is probably a few $100 million, obviously. And in order to finish the project, they had to get assistance from Mr. Wrigley, of Wrigley Chewing Gum, who then became the sole owner at the completion of the project. Mr. Wrigley then built, in about 2 years later, the Wrigley Mansion, which will be coming up in a near future video, for his wife. They spent probably 7 days a year here in that mansion. At any rate, the topic for today is medical marijuana and cancer. Medical marijuana became legal in Arizona in 2010 in November, and since then the Department of Health Services has been working diligently to put together the rules and regulations that go along with the actual implementation so that patients can start to reap the benefits of medical marijuana. One of those debilitating conditions that medical marijuana is qualified for is cancer. Cancer causes multiple problems that marijuana helps with. One is when a patient has cancer and they're undergoing chemotherapy for it, it can cause nausea, vomiting, decreased appetite, pain, and anxiety, obviously. All of those things marijuana is good for. So one of the overriding themes of my video here is to basically relay that when you look at all of the medications, and I'm going to call marijuana a medication here, you can't get a prescription for it because it's federally illegal, but let's call it a medication because it is. Marijuana helps for a broad array of symptoms. There are other medications like metoclopramide, prochlorperazine, Marinol, which is actually a synthetic THC that was approved by the FDA in 1986. There are singular medications that might work better for individual symptoms for when someone is undergoing chemotherapy for cancer and having pain and things like that. But when you look at the array of things that medical marijuana treats versus the side effects, it definitely has its place in the armamentarium of treatment. For instance, when a patient smokes marijuana, yes, they do inhale over 400 compounds into the lungs. If a patient has a terminal cancer condition, does it really matter if there's a long-term risk of cancer in the lungs from that? No, it doesn't. So let's put that aside for this discussion. The question is it more appropriate to do something like smoking marijuana or vaporizing marijuana versus taking Marinol, which is a synthetic THC that was approved, like I said, back in 1986? The answer is maybe. One of the things that patients say when they either vaporize or smoke marijuana is that they get a consistent, a quick onset of effect within a few minutes, as opposed to a couple hours potentially with Marinol. They also get a more consistent duration of effect. They know that when they take a few puffs of marijuana that it might last for 2 to 3 hours. So they know that. Another thing is it's not a pill. If you're nauseous and you're vomiting and you take a pill, you have to be able to keep it down long enough so that you can get the effect of anti-nausea while you're nauseous and vomiting. So that's a potential problem that's alleviated by the smoking or vaporizing of marijuana. Well, how well does it work? It works very well. You get a consistent onset of anti-nausea. Also, patients are able to increase their appetite, which is a big problem when patients have cancer. Patients with cancer, often over half of them get a condition called cachexia, which is a wasting away of the body of lean body mass. If you're going to lose weight, you want to lose fat, not your lean body mass. So what do patients do? Well, if they have to go on IV or tube feeding, that is replacing a lot, not necessarily lean body tissue. It's replacing other things as well. Well, if you can smoke marijuana or vaporize it and get your appetite back, or reduce the amount of weight that you're losing, that it can be very beneficial, because then you can go intake food that's going to replenish or keep your lean body mass intact. It can help keep you nourished, it can help keep you fighting the disease, and potentially, there's not studies to prove this, but potentially, make you live longer. Potentially. I can't back that up. I'm just, throwing it out there. So that's one of the things that, that you see. Helps with a broad range of effects. There was a study at University of Iowa that showed that 5 to 10 milligrams of intake of marijuana is equivalent to 60 milligrams of codeine in patients with terminal cancer for pain relief. Also, one of the things that you often see with patients with cancer is that they get a conditioned effect. They know that when they go to chemotherapy, that they are going to have nausea and vomiting. So it's not even when they start to get the medication, they're already having the nausea as a conditioned effect. The intake of marijuana can decrease the anxiety level so that that may not occur. So it can help in that regard as well. So my point, the overriding here, are two things. One is medical marijuana for cancer definitely has its place either as a first-line medication or as a definite backup if the other prescription available medications are not helping or there are too many side effects. That's the first point that I wanted to make. The second point is that marijuana helps with the broad range of symptoms as opposed to just one, like some of the other medications that are available. And the adverse side effects of medical marijuana are low. I mean, they're real, but they're low. So that is something to take into consideration. There's also one last thing, some anecdotal reports, case reports showing that the intake of medical marijuana can decrease the amount of opiate medication that patients need to take. Opiates can cause tolerance, addiction. They can also cause constipation, issues like that. So if they're needing to take less than the 60 milligrams of codeine, like in that study, maybe some of those side effect profiles can be reduced. Anyway, there you have it, medical marijuana and cancer. I'm Dr.